All right, we can go ahead and get started. Constance, you want to go first?
Yeah,
With the welcome.
the welcome. So we're going to get started. Today is our DDSN Provider Network meeting starting at February 24, 2025. Thanks everyone that would join us. We had one late submission question that I've been asked to address in regards to DDSN legacy properties. So Courtney Crosby, who's the chief of staff here at DDSN, is in the process of scheduling individual meetings with providers to discuss the possible conveyance of the DDSN legacy properties. Many of those meetings have already taken place. She is working to have all those meetings scheduled by Friday, February 28th. If you responded to the letter by the February 3rd deadline and haven't heard back from Courtney by the end of the week, please reach out to her directly. I don't know if y'all do.
All right. Yep, that is the welcome. Next on the agenda is Margaret with DHHS. Margaret, you ready for your updates?
I am. Thank you. Thank you. So wanted to give just a couple of updates. We sent out last week the day services survey. Many of you are aware that we have previously distributed and gathered information through survey on residential services and inputs that help with the rate model that we utilize for those services. We have just deployed last Thursday the day services provider survey. This was sent out from DHHS. Noelle Riston would be the individual that sent it out. It was distributed to all providers that provide day services. So if you have not received it, again, it went out last Thursday morning. It's titled Day Services Survey. Please be on the lookout for that. There is a response email within the body of the email, rehab survey response at scdhhs.gov to submit the results of the survey. We are also going to be conducting a virtual meeting to walk through the survey and answer questions on next Tuesday, February 25th. Excuse me, that is tomorrow. Wrong week. So tomorrow from 1 o'clock to 2 o'clock, the link to join that survey meeting on tomorrow from 1 to 2 o'clock is in the original email that was distributed. So please feel free to join us. We will be joined by our partners from Milliman who are assisting with conducting the survey. Again, this is critical information for us to help inform the cost associated with delivering day services and for distinct components that go into the rate consideration. So please pay attention and if you're able to join tomorrow at 1 o'clock, we would welcome you for a walkthrough of the survey. If there are individuals that have not received it, please feel free to reach out. We have been working with Noelle for any that she received bounce backs and to get them to the right people. So we feel like we've got a good list that we've sent out to, but this is a critical piece of our rate inputs. So we do request that the surveys be completed by Friday, March 21st. The results of this, as well as results from the previous residential survey, will be reviewed and considered as we look at ahead to future budget year compilations. So wanted to make mention of the day services survey. I believe Lori may be mentioning this, so I'm going to steal just a little bit of thunder, but to help support DDSN's efforts, I know they have reached out to certain providers as part of their pilot for the updated assessment that is currently being normed on residential rehabilitation services. whatever you can do to be responsive and to assist if you've been selected to participate or volunteer to participate in that process, please do so. It is a critical piece of going forward with those services and certainly how we have structured reimbursement around those. We know that we have heard from many providers challenges with certain groups of individuals, those needing behavioral interventions and things of that nature. So it is a critical piece going forward. So please, I would encourage you, if you are part of that pilot, to work with DDSN. We will be helping to support their efforts, but just wanted to make mention in support of that pilot and support anything that you can do in response to that. Those were my main updates, Lori.
Okay. I'm keeping an eye on questions. If anybody has questions, they can type them in the chat, or you can unmute as people go if you have questions or want to talk through anything. For my part of the agenda, I wanted to mention the directive changes. So we had a commission meeting last Thursday. We had 2 directives that were made obsolete, the short-term admission directive and the physical management directive. We had some changes to the appeal and reconsiderations directive. Those have been updated on the website, as well as the attachments to those directives. As case management providers, you guys know y'all send those out with notice of denial, reduction, suspension. Those are being updated in business tools as well. So we ask that if you have any copies of the old attachments to that directive, that you get rid of them immediately, because you need to be using the new attachments. Again, we'll kind of try to remind case managers of that going forward. The good news is there's not a whole lot of change in the intent. It's really wording changes. As part of the OIG audit, they wanted us to kind of firm up some definitions and make some consistencies throughout. There was also a brand new set of standards that were approved for a service called caregiver coaching. That service is a part of the behavior support service in the IDRD waiver. We are working now on the manual changes, and we'll provide training to case managers ahead of starting to enroll providers to provide the service. But we're really excited about that service coming online, so more to come in that arena. The other 2 items under my updates, billing issues is really something that I put on there because it was part of the list of what I think the Provider Association distributed a while back for what they want to talk about each meeting. I don't really have any updates, but I wanted to give you guys the opportunity if you had any issues around billing that you wanted to talk about. If I don't get anything in the chat, we'll just move on past that. And then the EHR updates, we currently have an RFP out there for a new electronic health record. It is currently paused. We have not issued an award on the EHR yet. As soon as we have information to report, we will report it. And that is really it for my updates. Janet, I think you are next.
Thanks. So I'm going to go over a few things and then which is kind of out of order for the agenda. So a couple of things for me to touch base on. We did release the medication technician training, the certified med tech training. It is the classroom portion of the curriculum. The curriculum has 3 parts. There's really the classroom training, practicum experience, and supervised med passes. So those 3 components. The training that is online is just the classroom portion. That information about that was sent out last week, maybe week before, not sure. It's available in DDSN's learning management system. DDSN has used its learning management system since around 2020, so about 5 years now. Most providers do have people in the learning management system. So if I go in and look, I can see that a provider is in there. Many providers have forgotten who their LMS administrator is, and are struggling to access it. So I am working with Intellectability to get a process together so I can send the information, and maybe you can either pin it on your email or print it out and stick it on your wall, so that you can remember how to do it. The other thing is that in 2020, when we started using this learning management system, we had providers coming, all of them coming online at one time. So the way the learning management system is kind of set up is that each agency decides who their LMS administrator is going to be, and that administrator is the one who assigns to staff the trainings that are required to be completed. So if a training is not assigned to you, you probably cannot see it in your log on. But the system also requires that all of your staff be put in. So in 2020, Intellectability was very kind. They sent providers a spreadsheet and said, if you enter your staff, we'll dump them into the LMS so you don't have to have one person sit there and enter all of your staff into it. So what you will see if you are a new provider that has not yet gotten into the learning management system, we will have a process for new providers, and we'll have a process for existing providers, so that if you realize that everybody that is in the LMS are people that used to work for you and you don't have an administrator anymore, we'll give you information about how to update who your LMS admin is. Once the person's designated, they get assigned a video that they have to watch and pass. So that's how that works. But that training is out there. I tried to suggest that before you start using this, just out of the box, start using the training, that you consider your own policies. Our directive says that you have to have a policy if you're going to operate a med tech training program for your staff. You've got to have a policy about it. Your policy is not going to say use the online training in the learning management system. So consider that with your rollout. And DDSN's in the process of updating the 60313, I think is what it is, which is the Med Tech Training Directive. So it should be out in a couple, I'm going to say a couple of months, might be a couple of weeks, could be a couple of days, but it should be out soon. So that's the Med Tech training.
There's one question specific to that on here,
Okay.
so I thought you might want to address it while it's fresh in your brain. For the online med tech training, does a provider need to have on file which curriculum is being used for the classroom portion for Alliant, or can they have some people who have gone through this classroom portion, another person who uses online? Like, do they need to have a policy that says we use the online portion, or a?
I think their policy needs to be specific to what they're going to do. If
Right.
you're going to have two different tracks, then your policy needs to say, I'm running two different tracks, and this is who you can expect when and where.
Okay.
DDSN would prefer to be out of the approval business. in terms of curriculum. Right now, it's administering meds the right way. If you're using that effectively and you've got a nurse and all of that, that's fine. If you don't want that to go down that route and have your own nurse, this takes the classroom portion of it. One of the things that's a little different about this classroom training is that the last module of the training is video demonstrations. And so you actually see somebody providing medication to another person by every route. And it has all of the stuff that the nurses go crazy about, which is the 3 reads and the stop and the documentation and all of that. So you actually have some video demonstrations in there. The acuity assessment, Margaret just touched on that. We just had a meeting about that. We're not where we had hoped to be. We had hoped to be completed with 500 people who were selected to participate. We're probably about a little more than halfway that number, which is kind of sad. We have extended it another month, so probably today, tomorrow, the next day, you will see more time slots opening up for the month of March, during which those assessments can be scheduled and completed. I really honestly think that when we first put this out, it was in November. We were hitting up against the holidays. People put it aside for Thanksgiving, and then they didn't get back to it at Christmas. And then before you know it, it's the 1st of January, and they've completely forgotten all about it. So we will be sending out some reminders. We now have the ability to see how many people in each category, or which providers have and which providers have not scheduled or completed the assessment. So we will try to target people who have not. If you get an email from me or from DDSN and the truth is you've completed it, let me apologize in advance, because we've had people substituted, so it could be that we didn't see it. But we will be reaching out to those who have not completed. Another reminder about the acuity assessment. In the information that was originally sent out in all of those instructions, we made it a point to talk about the informant. So the informant is the person who knows the person well, who sits with the person to answer the question. Certainly we understand there are people who do not use words to communicate, and people who are not going to actively engage in the completion of the assessment. The reviewer, the interviewer, still wants to see the person on camera. They want to be able to see them. So we want them in the room, even if it's just for 5 minutes, or if it doesn't take very long, we still want them in the room. The other thing is, an informant is someone who knows the person well enough to answer questions about them. So it is not someone who started yesterday, but literally that is an example that we were provided. That is feedback that we were given, is that it was somebody's first or second day on the job, and they were the informant for a person. So please make sure that when you're sending staff in there, is somebody who knows the person pretty well. You may recall that when we sent out information, one of the documents that was sent was called Stage 3 Questions. The interview is in 3 parts. The first 2 parts cannot be shared, or it would invalidate the assessment. But the third part is information that may require the informant or someone to do a little research. So those are sent in advance so that somebody can provide the informant with accurate information walking in the door. So that those questions were shared to help prepare and make sure that valid information was being provided. So again, opening up more times, and you'll probably be hearing from somebody, probably me, later this week about that. Any questions on that? None. The last thing just to touch base on is the issue of leases and provider controlled settings. It's kind of a long story to make the settings rule go away or stay forever and be compliant. The leases needed to, all of the leases, when the residential habilitation provider was also the landlord, the leases needed to contain an additional sentence. If you use the attachment C to the DDSN directive, the sentence has been added. If you have your own lease that you created on your own, the language that was added to attachment C or something comparable needs to be in your lease. And if you're not the landlord, you don't need to change a thing. The memo communicating this has actually been sent out 3 times, and that was my fault. The first 2 times it was sent, it went to residential directors versus executive directors. The 3rd time, it supposedly went to executive directors. In that memo, it kind of asks for a response from each residential provider to basically say, yes, my lease has this sentence, I use the attachment, or we're not the landlord. So one of those 3 responses, there are about 58 residential providers, and we've gotten about 26 responses. The good news is it's not due until Thursday. So when we sent this out, it went out initially in January, I think it was January 27th, and we gave providers about a month to respond to us, just to say, our lease is fine, we use the attachment C, or we're not the landlord. So we've got about half, roughly half of the providers that have responded. So if you haven't responded yet, please do. If you look and you cannot find anything about a lease that came from me or from Yolanda Goodwin, please email me and I will send it to you. So, all right, so there are 2 other parts to the operations update. One is quality management, which I'm going to let Ann Dalton do. And when Ann's done, Becky Peters is going to do a day service update, and then we'll be through with operations.
Can I, actually, I just asked Chris Clark a question. So he's looking for a memo on the DDSN site under executive memos. Chris, is that the lease memo? Is that what you're looking for? The lease one. So do we know if it's been posted?
I did not direct it to be put on that.
I will have somebody put it out there. It's not that big of a deal, right? We can just put it under residential or programs or whatever. So if you didn't get it too, if you reach out to Janet, she'll get it to you.
So I have 2 updates from quality management. First, I'd like to mention that program staff are currently looking at key indicators for the next review cycle. If providers have specific feedback about any of the key indicators for different service types or for the administrative indicators, please submit your questions or your feedback to qualitymanagement@ddsn.sc.gov. Also, I wanted to mention that national core indicator surveys are in progress. That's the in-person surveys. The participation in the national core indicators is a contract requirement for all of our provider agencies, and each agency should have received a sample around the first part of November. Some providers, some residential or day service providers have attempted to pass this information along to the case management provider. So I wanted to clarify that the provider that received the sample should be the provider completing the actual background survey. It's not meant to pass on to the case manager. We expect all providers to complete the sample that was sent to them. So again, if you have any questions about the National Core Indicator Surveys, please email us at qualitymanagement@ddsn.sc.gov. There will be information about the State of the Workforce Survey coming out in the next couple of weeks. We'll be kicking off that process. Both survey cycles will end on June 30th. So we appreciate your help with this. Thank you.
Okay, so I have two things to share about employment today. DDSN has facilitated 3 employment trainings through ABLE. ABLE is going to be talking about work incentives, planning and assistance, WIPA, and how to talk to our folks about benefits. And so the first session is going to be February 25th, which is tomorrow at 1 o'clock. You should have received an email, you guys, your employment specialist should have gotten an email on January 22nd concerning that. The other thing that we're pulling together here rather quickly is just a connection series, not really even a series, a connection day for employment staff. It's going to be an in-person Wednesday, March 5th. We have not actually sent anything out yet about that, but we're going to talk about employment and some trends that we've seen, some good stuff, some things to work towards, all in person on Wednesday, March 5th here at Central Office. So you should be getting some information about that very, very soon. For day services, we've got a couple of really good things going on. We've got a communication workshop series. We've partnered with CDR and the speech therapist there, Rachel Johnson. She's doing, she's doing a total of 8 the first half of this year. They are in-person communication workshops. Really make it or take it is what it is. A lot of hands-on communication with partners, in between partners, helping our day residential. Actually, we had a few case managers come in last week at the communication training we had down at Coastal Center. It is a very valuable training. I highly recommend it. You should have gotten an email about that on February 3rd. Our next communication workshop will be at Midland Center on March 14th. Any of these things, guys, just reach out to me about that. I can make sure everyone who wants to be on an email list is put on there. So please just reach out to me and I'll add names for day residential. Pretty much anybody who's interested. I got some feedback from the case managers and they thought it was very, very helpful as well, what they learned about communication. And the last thing we have, each month on the 3rd Tuesday of every month is a residential connection series. On the 4th Tuesday of every month, which I aim to talk about, is the day services virtual series. We'll take topics. It's not always me talking. Tomorrow is our day services connection series, and we're having Stephanie Turner talk about ways to communicate with our adults with autism and some behavior management strategies. So that's going to be very good. She's actually going to be doing the next 2 day services series, and that is virtual, right? So anybody can hop on. It is every 4th Tuesday at noon to 1 o'clock. It's a very short amount of time, but we pack it full of good info. Some other things we have coming up. I've got somebody coming in to talk about trauma-informed care and some other things that we'll be talking about there. Again, not necessarily coming from DDSN, just generally speaking. I do have some documentation for day training, for day services coming up through some in-person trainings that you'll hear about shortly as well, one in April and one in October. But the virtual has been really, I've had good feedback from that because everybody can just jump on and leave when you need to, get what you can from that small training. Again, email addresses, please just reach out, tell me who you need me to add, and I'm happy to add folks there.
I think that's it for operations.
I dropped Becky's email in the chat too, so if you have anything for all the reach outs, you can reach out to her there. All right, I think next is Mary with financial updates.
Okay, we're still working on the 200 series directives, on reviewing those and trying to get some of those updated. We're still waiting on some conversations to be had before we can issue the memo we talked about last month regarding paybacks and cost settlements and things, so that is still on hold. Specifically, some EI providers have asked about the ROAP directives 275-4 and -6. Those directives have not changed yet, so the requirements are still in place, so if you would still continue to do those. And it's a little bit early, but we have renewal of contracts coming up. We're supposed to have a 60-day notice if you want to renew your contracts. So some people have already started sending those in. You can send those in just as an email blib to LaKenya Craig, and her email address is lcraig, CRAIG, @ddsn.sc.gov.
All right, and I think there's one question on here, Margaret, for you, and it's just about the support center billing issue that you've been working on.
Yes, I saw that question. So we are working internally with our partners in program integrity as well as the CMS contractors. This is related to an audit issue. The findings that went out related to support center services, the code used for support center is also a code used for another program and other services. So there were some erroneous findings that were issued. We should be getting an update on letters that will go out from the vendor to what's the right word I'm looking for? To revoke or indicate that those findings are being rolled back. So I will follow up and get a timeline on when those additional notifications should go out. There is no further action needed on part of providers that did receive those, and there should be a formal communication closing that audit out. So that should be forthcoming. Appreciate the question.
All right, and I think after that, we've just come to questions and additional remarks. If anybody has questions or anything you want to talk about that wasn't covered in the agenda.
Lori, Margie sent a great reminder about Disability Advocacy Day, which is coming up really soon. I can't believe it's Wednesday, March 5th. That's a great time to get our folks to the State House to let their voices be heard. So Wednesday, March 5th. It's a reminder. Thanks, Margie.
All right, well, I don't see any additional questions. Again, you're welcome to unmute if you have anything. Otherwise, we will finish the meeting and give you guys back 20-something minutes of your day. All right, thanks everybody. Y'all have a good one.